Did the meeting before us not be held, or did they go early?
I don't, it must not have been held because nobody was here when I got here. I got
Okay.
here early, so.
Okay. Well, Terry's a member of that too.
Right.
I sit in the back and I never yet have been able to hear a word they say.
It was okay. I forget about the construction at the corner of Beecher. And I was in the turn lane from Beecher and it kept getting backed up. So I was just like stuck there. We couldn't go anywhere. I got to remember this. Hello.
They said the storm was about to come up forward and it's. That's the sign.
It's still raining, but I haven't heard anything crazy outside.
All right, I'd like to call our April 15th Board of Health meeting to order. First thing on the agenda is the approval of the agenda.
I move to approve the agenda for April 15th, 2020.
And I second.
All right, all those in favor?
Aye.
Any opposed? All right, our agenda is approved. We'll move on to the approval of the minutes from the March 18th, 2026 meeting.
I move we approve the minutes.
I support that motion.
All right, all those in favor of approving the minutes for March 18th?
Aye.
Aye.
Any opposed? All right, we'll move on to our reports. First off is the accounts payable report.
Good afternoon. I'd like to start by saying I apologize that it is so little and hard to read. I'll work on that next month.
My only question is on the first page, under the first bank card,
Mhm.
what is our EHS renewal fee?
Yeah, Casey, please.
So the REHS is the Registered Environmental Health Sanitarian Certification that I think there's 4 or 5 of us that hold that. And that has to get renewed every 2 years.
Okay,
That's the fee for that.
all right, any other questions on accounts payable?
No.
All right. So I'll be looking for a motion to approve.
I move we accept the accounts payable and place them on file.
I support.
All right, all those in favor?
Aye.
Any opposed? All right, we're on to our health officer's report.
Good afternoon. There's a few upcoming events that I wanted to make everybody aware of. On April 23rd, the health check is at St. Mary's Activity Center from 8 to 12. That same day, the Senior Resource Fair is going on from 9 to 12 at the Adrian Senior Center. On April 25th, the Drug Take Back Day is going on from 10 to 12 at ProMedica Hickman Hospital.
And the two.
Oh, thank you.
Which
What?
day?
10 to 2.
Okay.
April 25th.
Okay.
On May 9th is the Household Hazardous Waste collection. That is from 8 to 12. And it is sponsored by Anderson Development and Bacher Chemical, and it will be hosted by Bacher Chemical. On May 16th, there is a scrap tire and styrofoam collection day at the fairgrounds from 8 to 12. $4 for a car and small truck tires, $2 for motorcycle tires. There is no tractor tires or large truck tires to be brought, and styrofoam recycling is free. Moving on to respiratory illnesses in the county, overall, the activity is low transmission. Influenza and COVID are continuing to decrease. RSV saw an increase last week, but overall trends are declining. As of this week, as of Monday, the number of residents seeking acute respiratory illness care. Adults represent 79%. And those 50 and older is 35%. RSV cases are significantly lower than last month. Adults represent 21% of RSV cases and youth is 79%. Avian influenza is still around the state of Michigan. Last detection was March 12th and 16th in Kent County. Measles, to date, the state of Michigan has 8 confirmed cases in 2026. Recently in March, Washtenaw had 7 and Monroe recently had 1 here at the beginning of April. There were 30 confirmed measles cases in the state of Michigan in 2025. And if there's any questions, I'd be happy to answer them.
All right, hearing no questions, we'll move on to existing business. Follow-up discussion on the septic inspection approaches.
I prepared an analysis, a very high-level analysis for your review as an informational analysis. It compares how it would look, the 2 different scenarios and what that could mean locally. So if there's any questions or directions of further movement, we can discuss that.
I would just make one comment. If I thought the Shiawassee County one where you did everything seemed to be fairer. If there's a problem, it should be looked at. And I also thought if I'm somewhere, I'm in Lenawee County and somebody 300 feet from water gets it, has to have the inspection, someone 350 doesn't, then you just whip up an entire amount of antagonisms that don't need to be there. I also thought, I looked at it, I looked at the cost and the expenditures and whatever, but I thought it was very well done.
Mhm.
And when you were talking I had the section on the non-residential, was that talking primarily about stores and industries? And did that not include farms? Because farms would have far more sewage than was mentioned there. Is that correct or incorrect on my part?
Are we talking for the sewage analysis or the Eagle memos?
It was the addendum I'm not on speaker. It was after you had discussed the Traverse City, or the Traverse County and the Shiawassee County, and you were discussing the wells and the septic tanks and the analysis when you did it at, Sales. And then, there was a mention when the state had, rules and regulations for residential areas, non-residential plots. And I'm assuming that means stores and industries, but I wasn't just sure whether that, meant that and farms or what was included in that. It was at the very end of the discussion. Let me see here. And then I also had another question. Does Lenawee County have people that make it a living to go inspect septic systems?
Not that we're aware of.
Okay.
You see, if you want to.
So we don't have anybody that I know of that specifically inspects septic systems. We certainly have local home inspectors that
Uh-huh.
often will do that as part of their inspection.
Oh, okay.
They'll FOIA records from us all the time to try to figure out where the systems are so they can locate them during their inspections. So I know there are several individuals in the county that do those.
Okay.
And then obviously sometimes our septic installers or plumbers or people like that may be called out to specifically look at an existing system if there's an issue with it, to troubleshoot, et cetera. But there's not anybody that I know of that specifically just does those type of
Okay.
inspections.
Okay.
When we bought we're going to buy a home here in the county that had a sewer, we
Mhm.
had somebody come out besides the regular inspector to do a sewage inspection before
Okay,
we bought it.
okay. I had one other question. I appreciated the analysis. I appreciated the answer that we gave to the folks. And what I'm asking is, would this be a project that the county could do, that we could do financially and do it well? And, you know, do we have the personnel to do it? Do we have the finances to do it?
We do not have the personnel to do it. And as far as the fiscal impact, we would have to do a pretty in-depth analysis to see what that would look like. But, you know, right off the bat, we would definitely have to hire additional staff and build the program and credential, you know, inspectors and things like that. So I think it would be a very large impact. I couldn't give you a dollar amount until I actually dove
Okay.
into it.
Okay.
I think I'll try to go back to your question about the farms. I
Mhm.
think in general, no, a farm, just as a farm, would not be considered a non-residential.
Okay.
If they're going to put something on their farm, like they're processing or they're making a food product or something like that, where it's more, obviously a farm itself is a business, but typically it's more, you know, your house is there, it's residential. But if they're gonna put a building or something out there that would be more non-residential as far as a purpose, then that would be considered, that building would be considered non-residential. And as far as the sewage they generate, I think you're probably referring more to maybe like the waste, the animal waste.
Right.
So, and that is under a completely different set of rules, right to farm. Eagle would have more to say with that. MDR, that is not something that would be covered under this
Okay,
specifically.
thank you.
All right, great.
Thank you. Whoops, oh dear.
Maybe you don't want to take those home.
Is there any other questions about that analysis? Is there any further direction that this board wants to take, or we'll just put it to rest for now?
I would leave it at your discretion.
I wasn't here last month. I went over the notes and stuff. I didn't know what the recommendation, like if Casey, if you had a recommendation of opinion, you know, I see the
Sure.
two different options.
I think for us, it would really require a deeper dive into, to truly get enough information on what it would really look like, what the impacts would be. This was just a very like high level, because when the folks were here last month, there was a lot of mentioning of other counties and what
Mhm.
they do. And so I think when Monica put this together, that was kind of her goal, was to say, okay, here's a couple examples of
Okay.
counties that are similar, you know, and this is what they do. This is how much it's going to cost residents. I think we would really have to do a much deeper dive of what would that look like? And then once we know that, we can look at what would that cost and
Mhm.
how would we pay for that? We certainly, right now, like Monica said, we'd have to hire more staff. That's
Mhm.
obviously more money. A lot more time would have to be put into even building the program. That has a cost to it. So I don't know right now as far as recommending either way. I think we'd have to do some further digging
Okay.
into it.
I was thinking, isn't Dr. Sherman the medical director at Shiawassee?
He is.
He might be someone that could tell us about Shiawassee sometime when he comes. And then I'm thinking the same with this as I'm thinking with the state when they're making theirs that they've worked on for 25 years. They've worked on it for 25 years, but it doesn't look to me as if they've looked at how are you actually going to implement it.
There is a lot of gaps, for sure.
Yeah, and I'll just add to that, there is a fiscal analysis on the current bill, although granted it's the original version, they did just release a new draft with some changes, but I don't think it really changes the fact that it's, even they in that fiscal analysis couldn't put a definite amount on what it would cost local counties and health departments. It was, I think they said indeterminate. So they did say that they anticipated it would have a negative fiscal impact overall, just on the fact that, again, whether it would be us implementing something locally or the state passing something that we have to implement, it's going to take significant funds to get that up off the ground.
And also we would, you know, doing it locally, we would have to take a look at our environmental health code. And so that would open that up and that would be updated and revised. And so that would take a significant time. You would bring a panel together to do that as well.
I think it's important though that we keep pursuing it.
Yes.
Okay,
I don't think it should just be put on the back burner and
I don't think you kick the can down the road. It's not something you put here and say, I must do it today, but it's there and we continually see what we can do better.
so is there next steps that you would like to see done?
I really would like, I don't know, do you suppose Dr. Sherman knows how it works in Shiawassee? And Shiawassee, was that the one that was not quite so expensive?
That is the point of sale, Shiawassee.
Oh, that was the
point
point of sale.
Yeah.
Now, the point of sale makes sense to me.
I mean, I think, having numbers and costs, I
Okay.
think would be, that's something we would need before, any changes and looking like timeline wise and stuff like that.
Or making a recommendation to the Board of Commissioners. So I can start working on that. It'll be, I probably won't have it next month. It may be a couple months.
Okay.
Because once, we build a program that will give us, a definite idea of what it could potentially.
Mhm.
There's a lot of little things that we'll have to look at, and so I want to make sure that we have all of that in there instead of just giving a very wide range of, a cost. So we can get started on that for sure.
You know, I would think, like the person that said when they were looking at buying a house here, they'd have someone look at it. But some people don't know about septic tanks and fields and whatever. And they wake up one morning and the sewage is everywhere and they're wondering what in the world is happening.
Yes. Okay, so that will be our next action item is to start working on that. Also in your packet, I provided two overviews of Eagle has sent two different memos to us. And they explained kind of the direction that the state is requiring us or asking us to go. The first one is the non-residential sewage disposal. So ultimately what this is that anything under a certain percentage, 1,000 gallons, this has to go to Eagle for review. And we actually just experienced this, the EH department, and it did take 3 months for review. And it could be, added time, added cost, all the things. And so Casey, is there anything you want to add to that?
Just that, it's caused a lot of contention, with some other departments, some other counties, some other district health departments are taking some steps, getting resolutions from their boards of health, from their commissioners, basically saying that they don't agree with this, that they don't agree with this, what is, we consider a new interpretation. The Michigan criteria has been in place, I don't know, a very long time. And so it just seems like it's kind of an out of the blue, all of a sudden, they want to put the different interpretation on it. The most disappointing thing really has been with the example that we had that we sent was not only could we have, if we could have just done it under our local code like we've always done, they would have been ready to go probably within a month, I would say. Not only the amount of time it took, but when it came back, the level of review and oversight from Eagle is significantly less than what we would require. There's no final inspection even. So it just seemed, I mean, my personal opinion, it seemed kind of pointless.
Piece of bureaucratic nonsense.
It was just not what, if the whole idea was to elevate the level of protection, basically, we don't feel like it was as high of a level of protection as our process would provide.
So what type of a resolution do you need to forward to them to say this?
Well, and I don't know if that's what we're looking for. I think this was just an update.
Okay,
Yep,
Well-
and we actually had Corporation Counsel, when we first received this, we had Corporation Counsel do an analysis on it to say, are we required to do this? And they provided their opinion back that underneath their review and per the code that we do need to follow that.
okay,
So we are following that as of current.
but you can follow it, but can't you nonetheless send them a note and say you need to reconsider your policy?
We certainly can. We certainly can. There has been a lot of discussion with Eagle over many meetings that has been expressed, but if this board would like to take further action on this, we can absolutely move in that direction as well.
I would do that. I can't remember what we did, but we did it on another issue. Oh, it was an issue on a restaurant, if you.
Food
recall.
inspection, yes.
Yes, and that did have what I thought was a more positive outcome than the one they gave us originally. And all they can do, once you make your objections known, is to say, go fly a kite. But they may not say that. They may put your name on the kite.
Would you like a resolution or a letter from the board to Eagle?
Which one would bear the more weight?
I am unsure on that one.
I don't really know either.
I mean, the last time that we sent the letter to
MDARD.
MDARD, we did get a response from the head,
Okay,
which was quite impressive.
okay, then
So-
I would say send a letter.
Okay, we can do that, and then we'll give the board a copy of what we sent.
I would say send a letter, but I have to, I have three
I'll support
people
that.
here.
Make the motion. I support.
I make the motion.
All right, we'll be looking for a motion to send a reconsideration letter to Eagle regarding the non-residential sanitary sewage disposal regulatory update.
Yes, you have that motion.
Support.
And that's what I was talking about at the very beginning, Monica.
Oh, I kind of thought so, yeah. There was a lot of reports this month.
Yes.
The next one is a recent memo that we received from Eagle regarding additional water testing for those that are doing subdivisions, condos, or parcels that are less than an acre. This is another requirement or request from Eagle regarding making residents do additional testing. As I stated in this memo, we have not sent this to Corporation Council currently for review. There has been a lot of discussion regarding this second memo amongst all the health departments, and so we've just kind of held off a little bit on that one. But it does pose additional cost and time as well for these. Casey?
The only thing I'll add is that they did, after the initial memo, send a follow-up email that they kind of, not quite walked it back, but kind of walked it back a little bit. It's just very kind of, I feel like, in flux. The other one I think is a bit more, I don't know, stronger. This one seems to be like maybe they're having some more internal discussions and whatnot. So that's why we're just kind of, I think, in a wait and see at this point. But it adds a significant amount of additional testing that is not specified in this rule set. And I know that some other counties have expressed concerns about how they could defend it legally if it ever came to that. So again, this is another one that there's been a lot of talk, like Monica said, amongst the health departments. And if this is something that we can truly implement, basically they're trying to implement it via memo. And to me, it makes more sense to update it in the rules if that's what you truly want. So why they haven't done that, we're not sure, but that's the route that they've taken.
And also there's gaps on if those tests come back a certain level, or what is it that locally we're supposed to do? Is it deny? Because then that creates a whole nother situation. So
Mhm.
there's a lot of
Is this
gaps in this.
for new builds or current wells that are already?
It is for new or current wells.
This is specifically for properties that fall under the Land Division Act. So it would be subdivisions, site condos, and properties that are less than an acre if they were split after 1997. So that's typically what we've encountered a lot of lately, is that there's a lot of folks who have that split their properties and they make them less than an acre and they don't realize that puts them under a completely different set of rules. But this is specific to those. So if it's just a property that's not in a subdivision, and it will only apply to new subdivisions, I'll say that. If you're already in a sub, it doesn't apply. But so if you have a property that's greater than an acre or whatnot, this is not something that would apply to you.
Is there a current recommendation now?
So the current rules have, Monica had that, I believe, down at the bottom of the first page of that. The required sampling currently includes, and it lists everything on there. So the rules actually truly list out all of these different things. So basically what they're trying to do is with a memo saying you need to add all of these other samples on top of it.
Oh.
And I think like the one PFAS alone is like a $300 sample, like all by itself. So it's a significant cost. And the rules already allow us, if we have a property that's in an area that's a contamination site or maybe has some PFAS sampling in the area, if it makes sense that it's a contaminant that we're concerned about, we can already require the sampling. They seem to want to say, you just have to kind of wholesale sample for these regardless. And again, our thought is then you need to change the rule to say that, because right now it does specify what we're supposed to test for, and it does give us the ability to test for additional things in situations where it makes sense and where it's reasonable.
Any other questions?
So how much would all of those additional tests cost besides the PFAS?
I don't know off the top of my head, but I don't think any of them are all that cheap. I know PFAS in particular is one that's very expensive. So that's why we've had to require it on other properties, not necessarily these, but in areas where we know there's been PFAS testing, and we try to be very particular and only require it when we think it's absolutely needed. But it does add some substantial cost. We could get you the actual numbers if you would like.
All right, and I'm sure that adds an amount of time too, because those aren't like overnighty tests.
Right, exactly, yeah.
All right, any other questions on our follow-up discussions? All right, we'll move on to new business.
I do not have any.
All right, we'll move on to program reports. We'll start off with personal health.
So I can finally say as of this week, we're completely done with construction in the clinic. Finally, about a year later, year and a half later, we finally got the cupboards in our med room, and we got a new reception window installed on Monday, which is beautiful and looks 1,000% better than what was there from 1990, whenever that building was built. So I'm very appreciative of all of the work that Monica did to get our health department remodeled. It looks fantastic for all of the team and for all of the clients that come in. The other thing that I wanted to report is that we did hire a nurse practitioner. Her name is Sunny Roberts. She currently works as an RN at University of Michigan, and she is going to work part-time as NP with us starting, I believe, every Tuesday in June. So we're very excited to have her.
Very good.
Does anybody have any questions for me? Thank you.
All right, we'll move on to environmental health.
Alrighty, so you have your reports in front of you. Our numbers definitely seem to have picked up, like I kind of expected for applications. They're kind of closer to where we typically would expect them to be. We've had a lot of applications come in the last few weeks. I feel like it's a revolving door, which is good. I did want to point out with your food report this month, it is in a little bit slightly different of a format. This came from our new software after much work and labor to get it done. We did change the table at the back to compare basically the current month with where the numbers are for the total so far this year. And we did remove the bar graph. So if that's something that you would like to have, let me know. I don't know if I'll do it in the same way. If you found it valuable, the 5 years seemed like a lot to me. But if there's something else you'd like to replace it, let me know. But I did just want to point out that it has slightly changed. One of the things also that we added was the number of establishments opened and the number of establishments closed, because I felt like that was good data for you to have to kind of have a snapshot of how many food establishments close in a month, how many open, and then again, the running tally so far for the year. And then I think the only other update I really had was that we also hired someone. We have hired a candidate for the EH Tech for the summer. Very excited to have her. She's going to start at the beginning of May. And other than that, I don't think I have anything unless anybody has any questions.
I have one.
Sure.
I think somebody read to me from the paper, there's going to be a new McDonald's at Maumee and Maple.
So yeah, it's going to be, so they actually have already submitted their plans to us. We've approved, they had I thought an initial start date of April 1st, and I actually live over there, so I know it hasn't started yet. My understanding is it's with the city right now, so we've approved them from a food safety and license standpoint. I don't know if they're gonna get approved through the city, but yeah, it's basically right across from Miller's. I think
Right.
it's a dental office right now. They're gonna, the plan, I think, is to demolish that building, and then there's a tattoo little artist that has a office and a couple other empty offices in the building next to that. They're gonna tear both of those down to build that if they get approval.
All I'm
an issue.
looking at is, my God, what a traffic corner for.
Yes, there's been
McDonald's.
issues with the planning committee with the city. So I listened to those meetings and a lot of people that live over there are very worried about it because it's so close to the Maple intersection and Country Market and everything. So I saw that it looked like maybe it was going in originally the first city planning commission. They did not get approved to go forward,
Mhm.
but I haven't heard anything else. So
Okay.
to be
They
determined.
need to do something with that intersection. It's
Oh, when we came,
already really bad.
And they've like complained to MDOT and whoever they can
Yeah.
about it
Yeah.
as well, so.
okay, well, when we came by that corner, my sister, I said, this is where it's supposed to be, Judy. She said, my gosh, do you know how many fender benders there's going to be? I already knew that. Okay, thank you, thank you. So it's up to the planning commission.
Yeah, it's at the planning commission and then they'll make a recommendation to the city commission.
Okay.
But a lot of people that live there complained, said we don't need it. It's not a good location because of the traffic. So they were getting more information from the people that wanted to put it in there.
Okay.
So,
I mean, I don't live there, but I mean, I can't see, but I see. Thank you, thank you.
All right, any other questions for environmental health? All right, we'll move on to emergency preparedness.
We've been, working on all different kinds of things in emergency preparedness. Most recently, we are, conducting our annual renewal of our, budget. So Jamie has been working on that. That is due at the end of this month. And besides that, just attending the meetings and doing all the things.
Mm-mm.
All right, any questions for emergency preparedness? Hearing none, we'll move on to finance.
Hello again. All right, so our second quarter ended on the 31st. I am in the midst of working on the budgets. I'm also working on closing out the mid-year point and getting all of that reporting in. So you will see that in your packet next month. Our preliminary 2027 budget is typically due in July. So I'm starting all of that. It's a rather lengthy process. So that's fun. And then I've also in your packet included the third quarter vaccine pricing updates for you. For the most part, there wasn't too many changes. A few things, especially in the seasonal type vaccines, those ones have obviously increases in prices, but it is either the end of the season or it's almost out of season. So that's to be expected. And then we do have a couple decreases as well, but overall it's actually pretty close to what it has been for the last quarter. And a lot of it is probably supply and demand too, so that impacts that. Does anyone have any questions about any of the fees? We do try to keep it as close to cost as possible.
Do you foresee any changes like with rent from the county, anything like that? As far as operational, hoping not?
I'm hoping not.
All right, any other questions for finance? Okay, we'll move on to public comment.
I have one. I have on my shirt, and it's a shirt that I got when we had the COVID vaccination. And one of the reasons I have it on is I'm going to recommend an article to you. I don't know how long it takes you to read. My library for the blind, it takes 18 minutes. It's in the March 2026 Atlantic Monthly. The title is How America Got Sick. And it explains how we came from a nation where we died at an early death of all kinds of things. I was struck by malaria. I didn't think of that. And up until 1946, the death rate of children and the vaccination rates. And the man makes the point that health departments are a victim of their own success. But it is the most marvelous article in the world, if you have time to read it. It just really is. It's called How America Got Sick. It probably is a liberal article, and that's why I think it's a really good article.
Thank you, Leanne.
You're welcome.
I just, to follow up on the drug take back day, you can take sharps there, so let everybody know that they do take sharps. They just need to be in a separate container than the pills. So they do go into separate places, but they can come there and can pull up in the car. I won't be there that day, but come up, they'll grab them right out of the car. Don't have to get out or anything.
All right, my public comment is next month I won't be here, so if Terry is back and you're having a meeting, then we'll have him as chair. If not,
We'll make sure that we have a quorum. If not, we'll see everybody in June.
all right. I'll look for a motion to adjourn.
I always love to give that. I move the way adjourn. And I love to come.
I second.
All right, all those in favor?
Aye.
Aye. Any negations? All right, we